Metaphon Therapy, Lauren Duncan as the client and Sarah Pound as the clinician. What is metaphone therapy? It's based on metalinguistic awareness. It helps develop metaphonological skills, changes sound patterns rather than specific sounds, and gives the client the ability to think about the nature of language. The goal of this therapy is it allows the child to be an active participant in the intervention. The aim is to get the child to learn by experience and to have the child discover on his or her own how changes in articulation can be achieved. The goal is also for the child to repair his or her own communication breakdown. When to use this therapy? With preschool children, with children with restricted phonetic inventories, idiosyncratic processes, and moderate to severe phonological disorders. How to select target sounds. Idiosyncratic processes, various use of simplifying processes, the effect on intelligibility, and sounds available imitatively and spontaneously. The description of the proposed client. The age of the client is preschool age. The idiosyncratic process is initial consonant deletion. Moderate to severe phonological disorder. There are no disabilities, and the independent analysis and play-based assessment are used to determine the speech sound errors. The selection of target sounds. S and B were the target sounds. They are examples of short and long sounds that can be used to teach phonemic awareness. These sounds were deleted in the initial position of words. Baseline data will be collected using one-syllable words with S and B in the initial position. Baseline data will also be collected on phonemic awareness tasks. Phase 1. The aim is to capture the child's interest in sounds in the entire system, develop phonological awareness, explore properties of sound and importance of making distinctions. There's 4 levels: concept, sound, phoneme, and word. Phase 1. Level Concept.
This is Henry the elephant. Henry has a long trunk and a short trunk. Can you point to the long trunk?
This one.
Can you point to the short trunk?
This one.
Good job. Henry can wear the long trunk and he can wear the short trunk. Can you put the short trunk on Henry? Good job. Now can you put the long trunk on Henry? Great.
Phase 1. Level Sound.
This is a long sound. And this is a short sound. Can you tell me if this is a long sound or a short sound?
That's the long sound.
Is this a short sound or a long sound?
Short sound.
Can you make a long sound? Good. Now can you make a short sound? Good job.
Phase 1. Level Phoneme.
There are long sounds and short sounds. S is a long sound and B is a short sound. Can you tell me if S is a short sound or a long sound?
A long sound.
Is B a short sound or a long sound?
A short sound.
Can you make a long sound? Good. Now can you make a short sound?
B.
Great job.
The concept activity should also be used in other phases of the therapy in order to maintain the child's interest.
The long sound goes with Henry's long trunk. S. The short sound goes with Henry's short trunk. B. Can you put the trunk on Henry that goes with the long sound? Great. Now can you put the trunk on Henry that goes with the short sound?
B.
Good job.
Phase 1. Level Word.
The word sit has a long sound, S, and the word bit has a short sound, B. Can you tell me if bit has a short sound or long sound?
A short sound.
Good. Can you tell me if the word sit has a short sound or a long sound?
A long sound.
Great job. Can you point to the word with the long sound?
Sit.
Now can you point to the word with the short sound?
Bit.
Great job.
Phase 2. Developing phonological and communicative awareness. Client and clinician take turns producing minimal pair words. The last phrase is putting minimal pairs into sentences to facilitate communication and promote repairing communicative breakdowns. Phase 2. Minimal pair words.
Now we're going to work on some different words. The word sat has s, the long sound, and the word bat has b, the short sound. Can you point to the word with the long sound?
Sat.
Can you point to the word with the short sound?
Bat.
Great.
Phase 2. Minimal pairs in sentences.
Now we're going to work on putting these words into sentences. Sat. Henry sat on the steps. Bat. Henry hit the ball with the bat. Can you point to the one with the long sound?
Sat. Henry sat on the steps.
Can you point to the word with the short sound?
Bat. Henry hit the ball with the bat.
Great job.
Data collection. Data will be collected during the session based on imitative and spontaneous productions. It is not essential for the client to get the production correct. Verbal feedback and random verbal reinforcement is used. The clinician never comments directly on the inappropriate production. If the client picks the wrong production, the clinician addresses that word to discuss in hopes of spontaneous repair. Advantages. Predictable and repetitive. It's based on turn taking. Learning situation is unique to the client. There's no pressure to have each production correct. It influences and repairs the child's phonological system, and the child is an active participant. Disadvantages. There are no set instructions regarding a child who repeatedly does not produce the correct pattern. A supportive environment is key for this type of therapy, and not all children get this support at home.